that's a big part for me. It's like, I don't say yes to everybody. I know you don't say yes to everybody.
And don't get caught in this thing like everything on social media is legit, because probably 50% of it's not, or higher.
I saw this trend where it was clavicular. I don't know if you guys know who that is.
My kids do.
Okay, so he got a nose job. It doesn't fit his face. Why is that?
Everything we do is not just aesthetics, right? It's aesthetics plus function.
This is not the solution. This is just part of the process.
Yeah, people don't talk about this functional status of what happens whenever you have a procedure.
That's life-changing. That's game-changing.
When people hear about cosmetic surgery, they usually think about celebrities, influencers. Who actually goes through HKB's doors?
Man, I'll be honest. Like it could be practically anybody, because everybody has a different story, has a different issue. I mean, what are some examples of the people you'll see in clinic? Like tomorrow's your clinic day. Tell about who you'd see.
I mean, it's everybody. I think we see all walks of life. We see famous people. We see kind of the everyday individual. We see the mom kind of in suburbia. We see the individuals who live in kind of rural town America. And ultimately, that's the beauty of kind of what and who we are, is like, we'll take care of everybody. And so we see every single type of person.
Yeah, and I would say the other thing too is it's not like limited to a certain ethnicity
or socioeconomic status.
No, it's not. It's not limited to any of that. And you'd be surprised sometimes people who might be, whatever would be, historically titled as blue collar or white collar, like they're just as apt to subscribe to these services. And like I think it's changing. Like the acceptance and the socialization, normalization. I'm like throwing a lot of words here together, but like, it's becoming more accepted in the U.S., and so more and more people are seeking out and talking about it. I think we've always been taking care of everybody, but now it's more.
But it's also access,
yeah.
Right? I think everybody has access to kind of all these treatments and possibilities that are out there. And then with kind of what they're seeing on social media right now, they're like, oh, you know what? This person looks like me, or like I could see myself getting that procedure done to get that kind of result.
But the only thing I would say is we talk about this, we lecture about this, and then we're passionate about this. Like, we're not one trick ponies. You don't do the same shit on everybody. When someone comes in with his maybe this ethnicity and this kind of body habitus and this aesthetic desire, like they need different interventions. Some people want crazy curves. Some people don't. Some people you need to have placement of incision in different locations. Some people don't want to have a surgical intervention, need to do this. So it's like, I think with that. And I think one of the reasons why we're successful is that it's personalized. Like what we do has to be very uniquely personalized, even if like you think there's a better result to be had. Like it's really what the patient wants.
Yeah, you have to listen to them. You have to understand exactly what their expectations are, what they're looking for, what they want, and then tailor kind of the procedures, protocols, everything you're ultimately going to do to what they're looking for.
And I think the more satisfying thing is, you think about like, we both have kids, and you want to figure out what they want to do, and you think about what we get to do, and you do get to see, people of all kinds of backgrounds. You get to see professionals, you get to see males, females, kids sometimes, elderly people, middle-aged people. That's pretty fun. I mean, it's really great, and like making them happy. I mean, there's probably nothing better.
Yeah. What's amazing in clinic is half the time it's a social visit. I'm finding out what's going on, where they're going on vacation, what's happening in their lives, what's happening with their kids. Mm-hmm. Just having a good old conversation. They're like, oh, we got to circle back and actually talk about the actual procedure itself and potential interventions.
How do you determine whether a patient is a good fit, not just physically but emotionally? Just make sure they're in the right headspace.
I think that we've gotten good at this, but you always could potentially miss and not really understand. But I think the biggest thing is, have conversation with the patient, try to build rapport. Actually when we were in medical school and in training, like there's this concept of, building trust and empathy and, identification between you and the patient. And I think we all have different ways of doing that. Like yours is a little bit different than mine. I'm a little bit more kind of get down to business, but I also want to ask them other stuff totally unrelated to like, tell me what you want to see your breasts look like, or tell me what you want to do to your lower face and neck. You know what I mean? Like, what's your strategy?
I try to listen as much as I can. I ask open-ended questions. I try to listen. and try to understand exactly where they're coming from, what brought them to this point. Because as you imagine, everybody has a different story, to your point, right? They come in, they're like, they may have been teased as a kid, or they may have just gotten a divorce and they're trying to go into this new chapter of their life, or it's something that's been bothering them forever that they're now just coming in. What brings them in today, right? Because again, there's a reason why they picked up the phone, they made an appointment, they came in, they spent the time and energy to do that. And for me, it's really trying to get down to understanding their why and understanding the reason why they're ultimately here today. And then as part of that, what is their expectation out of this? Like, what is their dream result, their dream kind of experience and their dream outcome? And then see if what you and I can do as surgeons can accommodate that. Because ultimately, if there's a disconnect between what they're looking for and what we can offer, they're not an ideal candidate. So ultimately, we'd have to kind of part ways and say, hey, I'm not your doc. I don't think we can go down this road. But that's ultimately how we decide. I think it's like, all right, understanding their why. Are they coming in for really decent reasons, and can we achieve the outcome that they're ultimately looking for?
How do you think they decided to go between you and me? I think they want to see someone with like bomb hair or someone who's just a meathead.
Way better looking guy, smarter, more talented. I mean, the list can go on and on and on. But
it is interesting. Sometimes a lot of our patients, though, this is an important thing, is that there's patients are looking for the right surgeon.
Yep.
But I think we are also appeal to the right patient, and I think there is this responsibility that we face to make sure that they're a good candidate, that we actually identify with what they are wanting to achieve, and if we don't, to either have further discussions or help them seek somebody else out, or
to your point, I don't think patients really understand when they're coming in interviewing us. We're actually interviewing them as well. Totally. Right. And like, that's a big part for me. It's like, I don't say yes to everybody. I know you don't say yes to everybody.
Yeah. And one of the things, this is, one of the things where you're just getting real with things. Like every once in a while, if there's something that you take care of a patient and maybe they're not happy, or the result's not where it needs to be and needs to be adjusted, and you need to, like, which we're always willing to do. We have to make sure we're on the same page. I tell patients that I don't want to be adversarial. I don't want to be confrontational. If there isn't that trust there, we have to first build that trust and rebuild that trust, because like it's everything, and it's one of those things that it's probably any relationship, but even with patient care, and I think we all care about that. And at the end of the day, like, it all goes back to one simple thing: we're doing this to help people be happy because it makes us happy. And I think that's like the guiding principle.
Don't you see, though, G, it was like all these patients are like going towards docs who specialize in a procedure, right? But I think it goes a step further. I think patients are actually looking for doctors who are not only really talented at what they do, but coincide personalities with what they're looking for as well. I don't think it's a one for one. I don't think, oh my God, this is the tummy tuck specialist, I got to see him, and regardless, he can be a terrible individual, right? Like, it's got to be that combo factor.
Totally. Yeah, I agree.
How does their mentality change after surgery? So obviously they're looking for a specific surgery before, and then after the surgery, how do they feel? I'm assuming it's confidence, but I just want to get more context.
I'll tell you, it's the analogy I'll give you is just someone who comes in initially in consultation, they'll kind of be sergeant, they'll kind of be like looking down, kind of soft-spoken, and then they come back, a month or two later, dressed up, standing tall, strutting down the hallway, potentially like in heels and just like ear-to-ear grin. So, I mean, a lot of times the change is dramatic. Other times it's a little bit softer. You're talking to them, you're seeing how is it going, they're not saying anything, and you ask them, any issues, any problems? No, nothing at all. And how do you feel about things? Good. And then you'll see the result, and it's like, oh my God. And they're happy, but that's their personality. So I would say that it's different. It can be a little muted in some situations. It can be extremely over the top in others. But like, you can tell, and you get to know your patients, so you can tell if they're good or not. And if they're not, like, you quickly want to learn. But it's massive.
Yeah, the few times you see that they're not, you try to get down to the nitty gritty of why that's happening, right? Because it might be an implant size thing. Sure. It's like, oh my God, I love it, but I wish I would have gone 100 cc's more, right? But to your point, I love, a month later, 2 months later, when they come strolling into the office and they're wearing high heels and they're wearing form-fitted stuff, and that they didn't come into the consult dressed like that. You're like, all right, their confidence is through the roof.
Yeah, and then the other ways you tell is that they're like, I'm bringing all my friends. I'm ready for my next one. There's all kinds of things that indicate that, but you can tell them at the end of the day, we just want to make sure that they're super happy and they get what they want. And sometimes you actually can tell because they're doing other stuff. Like they are, I don't know, they're going on trips. They are in a different relationship. They are, buying different clothes. They're doing things. And so it's fun to see how this can interplay with life. Like this is not the solution. This is just part of the process. And, there are other people who have lost 100 pounds, 50 pounds, whatever. And they're like reinventing themselves. And it's part of that. And it's fun to be part of that process. Aesthetic surgery is really it is for a lot of people, and it's really so much more than what it just sounds like. It's not just cosmetic surgery.
It can be for everybody.
Yeah, I mean, it is we say is it's aesthetic and restorative surgery. When someone has huge breasts and you do a breast reduction and a lift on them, that's life changing. That's game changing.
Yeah, people don't talk about this functional status of what happens whenever you have a procedure done. Right. So you talked about one, breast reduction. What's another one?
Another one's abdominoplasty, or and skin resection after either mommy makeover or massive weight loss. All right, in that situation, you're getting rid of a hanging, pendulous, excess skin. People can get infections after that. They can't fit in clothes. Right, when they go run, it literally gets in the way. So you get rid of that. They can move better. You restore and reestablish their core. All of a sudden, their lower back pain can be alleviated. They can potentially have some genitourinary enhancements as well. And they're thin, flat, and tight. They're able to work out. They're able to do Pilates. They're able to do all this activity they couldn't do. Another one is when you do skin resections for legs or arms, where these people literally can't fit in their clothing, or they have this moving effect.
And
afterwards.
It's not just the body stuff. Even the face, right? Sometimes removing extra eyelid skin, people can see more and see better, right? Their visual field is extended. And so just removing a little extra skin above their eyelids actually has a functional result to it. So not everything we do is not just aesthetics, right? It's aesthetics plus function.
And there's also this other piece of, I think the most important thing about what we do is that there's a concept of when somebody thinks about themselves, how they see themselves, and then how they actually physically are represented. There's a disconnect, and we're literally here to reestablish that or reconcile that, so that there's not this significant disconnect, or where they're just that's not me. And when somebody feels like that, that's when I feel like it's an appropriate time to intervene, and us to be a part of that, so that a patient can be physically represented with how they feel on the inside.
So you're saying that their internal state has to match their external state.
Yep. And there's certain times where the opposite exists. If we get this ridiculous result and they're not taking care of themselves, they're not healthy, they're not optimized, that's kind of one of the things we're super passionate about. That's our responsibility also, to protect that and make sure that they're addressing that, because that's how you get the best results. I had a post the other day, and it got a lot of traction on it because I showed somebody.
You trying to boast that
no,
get a lot of views on social?
But it's important because the best results, and you've seen this too, where someone it shows a several year gap between extended abdominoplasty and then mastopexy, and then shows before afters, and it's oh my God, that is insane. And everybody's saying, well, where's the real before afters? Because she lost a lot of weight. She did. She lost a lot of weight. She optimized herself. She's active, doing all these things.
It's part of the whole continuum of care. You do surgery. It's not a one and done, and that's it. You ultimately have to take care of yourself before. You have to take care of yourself afterwards.
You got to put the work in always.
And if you put the work in, it shows, right? And it's and I always tell patients, it's let me do my part, you do your part, and your result's going to be ridiculous.
Mm-hmm.
I saw this trend where it was clavicular. I don't know if you guys know who that is.
My kids do.
Okay, so he got a nose job. Mm-hmm. And it doesn't fit his face, and he looked so much better before. Why is that?
Facial harmony and balance, same with body, is really important. And you think about a man, so a man has a certain masculine features, okay, and then those central in the face commands a certain amount of respect. When there is a distortion of that balance, it's a really large nose or a significant dorsum or a hook nose, there are situations where you can do some rebalancing to adjust that, and you can still maintain that masculinity and the features that are there. if it's overdone, and a lot of rhinoplasties are reductive rhinoplasties, right? And that's normal. Sometimes if it's over reduced, then maybe that there is not harming to the face. Case in point, one example is Michael Jackson, or there's other celebrity examples too where they've been overdone, or they've been having done several times. And so I think it's with a guy, you don't want to overdo it.
Right.
And the same thing with females too, to be honest. Like,
I think everything's about refinement and not necessarily going to the extremes. Sometimes people want to go to the extremes, and I think that's the issue. And I think ultimately, when it looks off, there is something off.
Right.
And then the hard thing
and
too,
it's amplified in the face, right? Like anything you do in the face, it's amplified.
Yeah. And the big thing, like, let's be honest, the hard thing to tell is like what's real, what's not. Like a lot of these, who's who or celebrities will get pics. They'll show before afters on social, and then I think social and then things are always meddled with. And so like for example, like the Kris Jenner's result. You see one that looks great, one that looks old, one that doesn't. Like there's a bunch of bullshit out there.
Yeah.
And like everybody's got to sift through that stuff, and like don't get caught in this thing like everything on social media is legit, because it's probably 50% of it's not, or higher. And so I think that's the only thing that's kind of crazy here. And with this, so this guy, who knows what he actually fundamentally looks like?
Right.
The question is, did he have a great rhinoplasty? And they tell it, and now they adjusted it to make it look overdone, but it's hard to say.
Thank you for listening to kind of the most amazing plastic surgery podcast out there, HKB. I'm here with my brother, Dr. Bahardi. Please subscribe to our channel. Listen for more episodes. If there's something you want to hear about, post in the comments. Let us know.
Just two Grindians making it happen.